Hi, good morning, everybody. I'm VICKI LIVIAKIS. Welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical advances. We also take your calls live on the air. With us today, we have plastic surgeon Dr. Stephen Williams. He'll be discussing liposuction and Brazilian butt lifts. Yes, that is what it's called. Later, we'll be taking your calls. Yes, Daria, answering your questions, any questions you have. The phone number 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, obviously, you're going to want a second opinion. Consult your own physician anytime you have anything done. Welcome.
How are you?
I'm great. A little shaking going on here, but
I know, yes.
We're going to steady our nerves. You know, I alluded to the Brazilian butt lifts, and again, that is the official term, right?
Well, it's the common term. It's a procedure that's become very popular, and it was coined because of the contour of the buttocks in Brazil, where it was kind of made popular.
On the beaches of Brazil.
That's correct.
Can't be beat. We're going to get to that in a few minutes, but first let's just begin with one of the more, I guess, popular things that that Americans seem to be doing is liposuction.
Yes.
You're doing a lot of that, I imagine. It's swimsuit season coming up. You know, it's not, you know, like going to the gym. I mean, this is a medical procedure.
It absolutely is a medical procedure, and it's one of the things that has gained some popularity over the last few years. And there's been a lot of marketing between different techniques and products, and it can be a little confusing for patients. What we always try to emphasize at Tri-Valley Plastic Surgery is patient safety and a results-oriented approach in that order. So we don't look at necessarily some of the newer trends, like there are a million different brand names, but we really sit down with the patients and say, let's talk about the areas you're concerned with. Liposuction can be a very powerful tool in targeted fat loss, targeted contour change.
But it's not a substitute for dieting or going to the gym.
That's a great point. It absolutely is not. So the patients that make the best liposuction candidates are patients that are actually near their ideal body weight and just have a little bit of stubborn fat in one or two areas, or a little bit of contour abnormality or contour area they're concerned with.
Well, we have some skinny minis that, you know, seem to be, you know, body obsessed, and they seem fine to the rest of us, but their own body image, you know, they're even if they're doing, you know, an hour or two at the gym a day, they can't seem to get rid of that final. Maybe it's after, well, childbirth, I guess, is a good example.
Well, you're right. There's really a wide range of patients that seek these types of treatments. Part of it depends on where they are in their life. Part of it depends on where they are in their weight. But you're correct that a lot of patients after pregnancy sometimes can find some areas that are a little bit difficult to correct. And liposuction can be a very effective technique to improve that.
What's the difference between, say, laser liposuction and regular liposuction? So
the public has been bombarded with a lot of kind of liposuction techniques that have been out there in the marketplace right now, and it can be difficult to kind of break down some of the differences. Essentially, liposuction is the basic technique. Laser liposuction, ultrasonic liposuction, they all still employ the basic tenets of liposuction, which is a small incision, cannulas to remove fat, and compression garments afterwards to contour the body.
Is one more effective than the other?
That's a great question, and something that's hotly debated. There are several university studies that have come out that show there actually isn't any difference between the skin tightening or overall contour in most cosmetic types of patients between the different types of liposuction. In our practice, we use primarily tumescent liposuction, but we've used all the different tools that are out there. We do use ultrasonic liposuction for male gynecomastia, for men that have some extra breast tissue, and also occasionally in times when people have had multiple liposuction procedures before in a certain area.
Okay, and for those who, just really quickly before we go to break, I mean, we're heading into swimsuit season, as I alluded earlier. Is this something that you need to do months in advance, or what about the healing process?
That's a great question, and really now is the time to do it if you're looking towards getting ready for bathing suit weather or something along those lines. And the reason why is there can be a significant amount of bruising and swelling that goes down over a period of months to get your final result.
Okay, we're going to need to go to break. And speaking of bathing suit season, okay, so we will be talking about those Brazilian procedures. But for more information about Dr. Williams, you can call 925-875-0700 or check him out on the web at trivalleyplasticsurgery.com. And when you call and mention Body Beautiful, you'll be able to receive a complimentary consultation in March and April. Of course, we're running out of time in March. And receive 10% off any procedure or injectable. We'll be talking about those Brazilian butt lifts and take your phone calls when we come back on Body Beautiful. Welcome back to Body Beautiful. We are talking right now with Dr. Stephen Williams. We'll be taking your calls with any questions you might have. The phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. Remember, any advice we give you today, certainly you want to consult with your own physician as well. Well, doctor, let's just jump right into it. Curves are in.
Curves are in.
So this Brazilian butt lift, explain a little bit about what that is for folks who don't know what that is. And
Absolutely.
That would be me included.
Well, the concept is moving tissue from one place to another. It's a concept that's very appealing for plastic surgeons. It's kind of the modern day recycling, if you will. What we do is we perform liposuction under special techniques to harvest fat, and then we select the best fat, and then we can, under special techniques with special instruments, re-inject some of that fat to enhance the contour of the hips and buttocks.
Okay, so basically you're taking the fat from unwanted places and reshaping it in the buttocks.
That's
area.
correct.
What's the difference between that and an implant, per se?
Well, very good question. Originally, when people wanted an improvement in their contour, they were either looking at a traditional butt lift or a buttock augmentation with an implant. Mm-hmm. Implants in the buttocks can be somewhat challenging because, unlike other places in the body, people sit on it a lot. There are a lot of complications with scar tissue, infection. So the concept was, why don't we find a natural part of the body that we can put there, something that is part of you that isn't prone to rejection, infection, or scar tissue. Right. And that's something that is your own fat.
Okay. Well, I'm just kind of curious, why would anybody want him this procedure?
Well, it's a good question. Typically, the people who are coming to our office looking for improvement in their contour also have some areas that they wish to have liposuction. So the typical person is someone who's close to their ideal body weight, maybe has lost a little bit of weight after pregnancy, and their buttock isn't exactly in as youthful a position as it was when they were younger. We all are victims of gravity as we get older. So the concept is to be able to improve some of the areas that they're concerned about, their abdomen, their flank, their arms, their thighs, and while reducing those areas, augment the areas that they'd like improved.
Okay, we have quite a few calls coming in, but okay. I just, do people come in and say, okay, I'd like the Beyonce butt lift, I'd like the J-Lo effect?
Well, you're hitting on something that we are beginning to see. There's a lot more attention in the popular media to the advantage of having some curves, and as people are beginning to realize that curves are natural and curves are beautiful, that's something that people are identifying with popular people in the public.
Okay, let's go ahead and take some of our calls now. Cindy from Sonoma, good morning. Cindy, you're on the air.
I'm here.
Hi.
Hi, Cindy.
Do you have a question for Dr. Williams?
I do, but it's not about a butt lift.
Okay, that's
no
all right. Plastic surgery is plastic surgery.
That's right. Doctor, about 9.5 years ago, I had a tram flap.
Yes.
And I have so much scar tissue in my abdomen area, it almost looks like that I am pregnant.
Okay.
And it enhances when I eat, even if I eat very little. And I was wondering, do you feel like I should have another surgery to have the scar tissue removed?
Well, it's a great question, and scar tissue is something that can be very challenging. Of course, anytime that someone undergoes surgery, the body heals itself with scar tissue, so scar tissue is a natural part of the process. Can I ask, was it a pedicled tram or was it a free tram? Did your doctors tell you? Was there microsurgery involved?
Well, I don't think it was microsurgery.
Okay.
I do know that I was cut from hip bone to hip bone.
Sure, so that sounds like it's what would be described as a pedicled tram, meaning that the abdominal tissue that was used to recreate your breast was based on part of your rectus muscle. Now, when they take the rectus muscle, and I've done this operation many times, when we take the rectus muscle, that can cause abdominal weakness. Typically, what we do to try to correct that is we put a layer of, in addition to closing the defect, we put a layer of either mesh or a substance over it to reinforce the abdomen. What you might be dealing with could be scar tissue, but it could also be some weakness in your abdominal wall, and you may benefit from a physical exam and maybe some imaging to try to get a sense of exactly what's going on with your abdomen.
Okay, thank you, Cindy. We've got to take a quick break here. We'll get to the rest of your calls, I promise. But for more information about Dr. Stephen Williams, you can call him 925-875-0700 or check him out on the web at TriValleyPlasticSurgery.com. And when you call and mention Body Beautiful, you'll be able to receive a complimentary consultation in what's left of March and April and receive 10% off any procedure or injectable. And when we come back on Body Beautiful, we'll take your calls and we'll have more to talk about with Dr. Williams from Tri-Valley Plastic Surgery. Stay with us. Welcome back to Body Beautiful. With us now is plastic surgeon Dr. Stephen Williams from Tri-Valley Plastic Surgery, located in Dublin. And first, let me remind you that we'll be taking your calls live with any questions you have for Dr. Williams about plastic surgery. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you're certainly going to want a second opinion. In all cases, really, right, doctor?
Absolutely.
Okay, we've talked about the Brazilian butt lift, and I will get back to that.
Okay.
We've also talked about liposuction, which is probably one of the more popular plastic surgeries being done in this country.
It is very common.
The total package, the mommy makeover, I alluded to that too, that is becoming more and more popular. And certainly, again, with Hollywood, we see some of the young starlets, they have a kid, and it seems like a week later, they're back looking svelte. It isn't often by magic, is it?
Well, you know, it's a difficult question to answer. Motherhood and pregnancy are wonderful things, but they can take a bit of a toll on a person's body. And I think that, again, what's becoming more prominent in the media is kind of looking better after that, so you can kind of enjoy looking good and being a mother at the same time. So the mommy makeover concept is kind of multifactorial. You're looking at an improvement in the breast shape, you're looking at an improvement in the abdomen, and you may be looking at an improvement in the shape of the buttocks and the legs, kind of an overall...
Okay, and the most important question for moms out there, I mean, what about the recovery time, unless you have, you know, an army of nannies, which most of us don't have?
That's a fantastic question. It's something that we spend a lot of time talking to our patients with at Tri-Valley Plastic Surgery, finding the right time to do surgery. These are elective procedures, and you never want to do it if there's going to be an increased medical risk, and you really don't want to do it if you have things at home that might interfere with your recovery. And sometimes those things are the little ones.
Right, yeah. And well, as long as Dad pitches in, I guess that's okay. Let's go ahead and jump into some of these calls now. Padma from San Jose, good morning. Do you have a question for the doctor?
Yeah, I have a question, certainly not about the butt lifting, it's about the butt slimming.
Okay.
I wanted to know because I had a couple of surgeries, like, I mean, what do you call it, fibroid surgery and some IVF treatment, with the result I was left with water fat in the water content in the body.
Okay.
And now I have a flab near lower abdomen and upper abdomen, and also, like, I have some accumulated fat in the butt area. So will the liposuction help us to get rid of those and become a normal, women structured body?
You're talking about redistribution of the wealth.
Yes.
Right?
Padma, thank you for the question. It's a very good question. Anytime that you're looking at a procedure to contour the body, you want to take into account a couple things. Number one, are our patients close to their ideal body weight? Because that's going to maximize your results. After that, the considerations you need to take are, is the contour, the difference in shape, the parts you're concerned with, is that because you have extra fat? Is it because you have scar tissue? Is it because you have extra skin? What are the considerations that are kind of creating overall the contour problems that you're dealing with? So it's a difficult question to answer. Liposuction is very good at treating the kind of internal lumps and bumps, but it's not very good at treating excess skin. And so patients who have had a lot of weight loss or have had a major change in a part of their body can have extra skin, and liposuction is not very effective at treating that. And there may be there are other techniques and surgeries that can address those issues.
She can call you and you can give her all the
We're always
we're
always available. We're happy to help.
We've got so many calls, but we've got to take a quick break here. For more information about Dr. Williams, call him 925-875-0700 or check him out on the web at TriValleyPlasticSurgery.com. When you call and mention Body Beautiful, you'll be able to receive a complimentary consultation in March and April and receive 10% off any procedure or injectable. When we come back on Body Beautiful, I promise we will be taking your calls. We'll be right back. Welcome back to Body Beautiful. Plastic surgeon Dr. Stephen Williams is with us. We're going to be taking your calls. I did promise that. 800-440-4884. Again, we'll be putting the number for Tri-Valley Plastic Surgery up and at the end of the segment, so be ready to jot that down. And our caveat, always get a second opinion. We got to jump right into this. You are highly trained. You know, we sort of glossed over this, but give me a really, brief background on it.
Sure. Well, obviously, surgery is a serious consideration. And whenever people are looking for a plastic surgeon, it's important that they go to a board-certified plastic surgeon. And there's some confusion, but you really want to find someone who's board-certified by the American Board of Plastic Surgery. That's critical, which I am. I did my medical school training at Yale University, and then I did my plastic surgery training at Yale as well. So I stayed at Yale the entire time for my training. In order to be board certified after your medical school and residency training, then you have to take a written and an oral exam, and that process takes 2 years. So it's a fairly stringent requirement, but it's something that you really need to look at to make sure you're getting someone
when you're
who
shopping for a plastic surgeon, first and foremost.
Don't compromise.
Board plastic. Okay, you've also made trips to Honduras. Really quickly, reconstructive. Tell me just quickly about that.
Well, I have. I travel down to Honduras, San Pedro Sula, Honduras, once a year to do reconstructive surgery, mostly on children. And it's something that I got involved with at Yale, and I go every year, and I think we just finished up our 6th trip, and we do on average about 100 to 150 surgeries on children over one time.
Very satisfying.
It's wonderful. It's really nice to give back. It's a great experience.
All right, I promise we take some of our callers. Chris from Sebastopol, really quick question for the doctor.
Hey, Dr. Williams.
Hi, Chris.
Listen, I'm 44 years old, keep myself in very good shape. I surf a lot.
Sure.
And my pectoral muscles, no matter how much I work out, I've got one larger than the other. Like there's more fat tissue in it.
Thanks, Chris. Asymmetry, right?
Well,
it happens in nature.
It does. So there's always a little bit of asymmetry. Things that we always want to be particularly concerned about is men can get breast cancer too. So if it's something that's come up recently or it's particularly enlarged, it's important to have that checked out to make sure that there aren't oncologic issues aside from the cosmetic. Once those issues are ruled out, you may have a little bit of unilateral gynecomastia, and that's where a male's breast is a little bit larger than normal, and that can be treated with liposuction. But the important thing is make sure it's not cancer. If it's not, liposuction techniques can be very effective at balancing some of that out.
All right, Chris, hope you heard that. Let's move on to Ari from Alameda. Quick question for the doctor, Ari. Hi, you're on the air.
Hello?
Hi, Ari. Do you have a quick question for Dr. Williams?
Are you calling Terry?
Oh, I'm sorry. Well, do you have a question for the doctor?
Yes, I do.
Okay, go right ahead.
Okay. If I had liposuction in my stomach and I was a senior citizen, would it be possible that I might get a blood clot in my leg or something?
Good question. Thank you.
It's a fantastic question. Thank you for calling. Any operation has potential of complications, and there are always 4 complications that are possible with any surgery, no matter how big or how small, and that's pain, bleeding, infection, and scar. What you're referring to can also be a serious complication that can be associated with general anesthesia or procedures on the lower extremity, and that is a blood clot forming in your veins, and that can be very serious if that blood clot breaks away and goes to the lungs. There are a number of techniques that you can use to minimize that, and we use all of those, but patients who have a predisposition to it or who've had blood clots in their legs before need to be especially careful.
Yeah, very important too. Irene from San Jose, really quick question for the doctor. About acne? Hi.
Hi.
Hi, Irene.
Yeah, my name is Eileen. I'm calling from San Jose, and my question is I'm in my 50s. I do not have a lot of wrinkles, but my face still breaks out like when I was a teenager, and my skin is dull, and I just wanted to know if there's some kind of polishing technique, either with laser or whatever.
Adult acne. Is there a cure?
I have that, and just kind of dull skin.
Okay, thanks, Eileen.
You know, skincare has been something that's received a lot of attention, both commercially and medically, and there are a lot of good techniques and products. The most important thing that we recommend as physicians is sunscreen, because that will keep your skin looking young and, more importantly, protect you from skin cancer, which obviously is important. In terms of treating acne, in terms of kind of getting that glow that you see and everyone talks about so much, you're really looking at skincare regimens and kind of routine care, things like microdermabrasion, laser reserved for brown spots.
You know
can all
what?
be very
Eileen's
effective.
going to have to call you at your office because we are out of time.
It's a big
Thank
topic.
you so much. We have so many more calls to get to. I guess I'll have to have you back. For more information about Dr. Williams, call him at 925-875-0700 or check him out at the web at TriValleyPlasticSurgery.com. When you call, mention Body Beautiful, you'll be able to receive a complimentary consultation and receive 10% off any procedure or injectable. That's this month in April. Join us again next Monday at 11 o'clock for our next edition of Body Beautiful. Thank you so much for joining us. Have a great day, everybody.